Hello friends. Today I am going to talk about how to improve the immune system of children. I am not an expert in this field, but yes, I am a mother of two children and have observed them growing up through these years and done a lot of say things that I heard from my uh, grandparents or my parents and also from my peers. I tried a lot of things. Along with a scientific background, I'll be able to discuss a few things with you guys. So maybe it is of some use to you people. So, what is this immune system and how it develops? The immune system consists of a lot of white blood cells, antibodies. We all know about it, but we forget that it is an interplay between the genes and the environment. So, the child has a genetic background, that is the genes that the parents have given and the environmental exposure that together helps the children to develop the immune system. So it starts from birth. So first thing after childbirth is the breastfeeding, which is utmost important in developing the child's immune system. The most important factor in breast milk is something called IgA, that is the immunoglobulin, which is transferred from mother to the child, which helps in fighting the early infections. But at the same time, the early breast milk has got something called colostrum, which is having leukocytes, that is the white blood cells, which are actually entered into the baby's immune system, and that helps the baby to develop a strong immune system. So the breastfeeding is the most important factor, and it has to be continued as long as possible for the child to have a stronger immune system. Next comes the introduction of foods. So, what kind of food we give to the children plays an important role in developing their immune system. Our traditional diet always is the best. Wherever there is an environmental factors that are helping to develop our nutrition. So, the environment in which the child is there, for example, the child is growing in India, the Indian diet is the best for the child. But this is best for Indian genes as well. So, a child who is in India having Indian food will have a much better immune system than an Indian child growing in elsewhere, say in US or UK, anywhere in the world. It is the environment which is designed the diet. We should understand that. Next, as the child is growing, we tend to introduce different foods and they tend to start eating junk and the food, packet foods and the sugary drinks, all these things which we need to put a limitation, and we cannot avoid it fully, but we have to complement with the traditional diet, and we should show the children that this is the best diet, which most of the schools are encouraging, which is a welcome trend nowadays. Next, trying to play video games and they are indoors, but it is very important for the children to play outdoors, play in the mud. Mud has got a lot of things that can stimulate the immune system. And also, suppose if a child gets worms, worms also in a way help in child to get the immune system development. So deworming is important, but the child getting a worm is equally important to develop the immune system. Similarly, the children who are exposing in the sunlight, they get enough vitamin D exposure. So the physical activity in the sunlight, the games that are played outdoors is very, very important. Don't think that your child will get tanned or become dark just because they exposed to sunlight. It is okay. It is okay to get tanned. So what? Let them get enough vitamin D, let their bones become strong, let their immune system become strong. So tanning is good. So parents should encourage the children to play in sunlight and get enough vitamin D. Vitamin D is a vitamin which is a fat soluble vitamin which is absorbed only when the body is having a fat content in the food. So the food what we give to the children, especially the desi ghee, which is very important for the children to assimilate vitamin D. So make sure that you give a spoon of ghee every day in the breakfast for children. which helps them to get vitamin D. And then make sure that your children are taken care at home for small minor ailments. For every running nose or cough, you need not rush to a pediatrician. There are good old home remedies which most of us know from our grannies and our mothers, and we are also grown up like that. So certain home remedies, may it be turmeric milk, may it be jeera and coriander powder with a kashaya, or may it be a ginger, dry ginger or something like that, which helps the children to fight the infections without antibiotics. So limit the use of antibiotics. Only certain warning signs which your pediatricians might have told you, those things will help you to identify. Just observe the children for minor elements. Just observe and give home remedies, and then wait. If they don't recover, then only meet the pediatrician. And then small fever, suppose 99-degree fever, we need not treat the children for that. We have to wait and observe. And fever is a friend. My professor used to say fever is a friend, not an enemy. So fever is an immune response of the body. A minor fever which will not harm the child, but it helps the child to fight against the infection. So don't give paracetamol, rush and give paracetamol for a minor fever, like very little fever. Avoid giving any medication. Another important thing which helps the children to fight against the infection at the first entry level, that is the throat, just making them do a salt water gargling every day. And suppose if they have eaten something you feel was not so hygienic, just make them do a salt water gargling in warm water. That will help a lot. If the child is not cooperating so much, you can show them, demonstrate them. They will do it very easily and they'll enjoy doing it also. So these kind of small things, little things which help as parents, I have tried to share with you people.